And welcome back to AM Northwest. Your dental health can affect other areas of your body. And here to share how implant dentures can help alleviate some health issues, please welcome back from Sleep Dentistry Defined, Dr. Heath Lampee, and one of his patients, Bill Malloy. Nice to have you both here. And Bill, you dealt with colitis for several years, and it affected your dental health. How so?
The medication that they put me on 13 years ago when I got this causes dry mouth and a number of other things, and my teeth just started to deteriorate.
Yeah, and did you go to other dentists and try and find a solution?
Quite a few of them.
Yeah, and was a solution ever found?
One tooth at a time.
One tooth at a time. And Dr. Lampee, that's not the approach, right? That's not what we want to do. We don't want to just, I think that the term that was used was kind of patched together to keep them going, but not a permanent solution.
Yeah, and when Bill came in, he had been patched together tooth by tooth by tooth over years. Each of his teeth had gotten root canals, and then when the root canals got infected, those teeth got new root canals. But the thing is like, you can't kill all the bacteria in those teeth, so there was like a low-grade infection in all of his teeth. And I looked in his mouth, and I'm like, I think we really need to just take these teeth out. The patch-by-patch approach isn't working.
Yeah.
And so we talked about it. You know, it was kind of a radical plan in a way, because he'd just been patched and patched. So in one day, we did a big surgery, took out all the teeth, did 8 implants, 4 on the top, 4 on the bottom, and got rid of all that low-grade infection that for years was affecting his health. Was
that infection the result of colitis for so many years, or just the patchwork of dental work?
No, everybody can develop an autoimmune disorder like ulcerative colitis or Crohn's or other things. But what happens is if you have a big infection in your mouth, over time, it can exacerbate those symptoms that your autoimmune disorder is having on the rest of your body. So we took out Bill's teeth, the infection, and now his colitis is actually doing better.
Oh, now how is that so? That's interesting.
His body's not having to fight the infection in his mouth anymore.
Right.
It's part of the digestive system.
It kind of gives a break to the immune system to go deal with other issues.
Yes.
Exactly.
Yeah.
How long did it take, Bill, to get all the dental work done with Dr. Lampee?
It started at 7 o'clock in the morning, and I woke up about 8 o'clock at night at home.
Mm-hmm.
Is that right? So just in one day you were able to do all that?
We had our preparation appointments beforehand to make sure everything was done properly. We dot our I's, cross our T's, we do our homework. So he was there from 7 a.m. that day till about noon, where we did the big surgery. He left that day with teeth in, and then there's a healing period for 3 or 4 months where the implants actually heal and fuse to the bone. And once they healed, we were able to do a connection, and that connection day starts at about 7 a.m. and then ends at about 4 o'clock that day. So all in all, it took about 4 months to totally finish everything.
Now, for dental implants, you don't have to have a chronic disease that you're dealing with to qualify or be a patient for that. It's just it's a good solution for a lot of people under different scenarios, correct?
Yes, there are so many different scenarios. I mean, I have some patients who come in who they don't need implants. I mean, maybe they need their teeth reconstructed in a different way. So we have different options, but we see a lot of these patients, so we know what to look for, and we also understand that a lot of patients are just frustrated from being, not told like really what's going on in their mouths.
And Bill, what's it like now to have the new teeth? I know we have before and after pictures. What's it like for you? Here we are. That's a remarkable difference.
Oh.
Yeah.
That's a huge difference. How does it feel to you?
Fantastic.
Yeah, and what do people say to you?
They don't even notice.
They say things to you like, did you shave your mustache? Did you lose weight? What happened to you?
Nobody's really asked.
And they look like they could be original teeth. There's no way you could tell that these were implants.
It's just like a natural smile. It's like just like a little masterpiece in there. So.
It is indeed. Yeah. If you'd like more information, you can contact Sleep Dentistry Defined. The phone number is 503-646-2273. Bill, thanks for sharing the story today. Dr. Lampee, always good to see you.